Hi, I'm Dr. Susan B. Wilson. I'm a licensed clinical psychologist, but actually, my interest in psychology stemmed from, growing up in public housing and seeing people struggle with a lot of things, both mental and physical. And I just felt like I wanted to do something to be a part of healing that. And I had to go to school for a lot of years. But my career has been very helpful because there's nothing like being able to help people. And I have clients who are still alive who say, if it hadn't been for you because they were suicidal, if it hadn't been for you, I wouldn't be here. So that's my best reward when I hear those kinds of stories. I'm a mother, a grandmother, and currently I'm working at University Health doing some diversity and inclusion work, which, by the way, draws heavily into psychology. First of all, anxiety and depression are like the common cold of mental health. It's very common that people have these things. Life is stressful. We experience losses, which cause us to sometimes develop certain kinds of symptoms. And then we have the holidays, which are very stressful, both financially and emotionally, because of remembering people who we have lost and aren't with us with the holidays. And so some of the tips that I tell people are number one, you have to put yourself first and take care of you first. Because sometimes we worry about so many other people in our lives that we don't take care of ourselves. And you can't help anyone else if you don't put yourself first. I think also using, when we're down and depressed, the best medicine sometimes is things like prayer and meditation, which helps us center ourselves and focus on what's really important, but also being with friends. A lot of times when we're depressed and stressed, we isolate ourselves. And that's the worst thing you can do because all you do when you're alone is dwell on your problems and think about everything in a negative way. But sometimes getting outside of yourself and being with friends that are caring and supportive of you and staying away from those people in your life, we all have them that are negative. They're complaining. They always have an axe to grind. Those are the people you should stay away from when you're stressed. I think also some people enjoy music or various hobbies. Whatever you do that you enjoy, you should try to do that. And that really helps reduce your stress. Also, with Christmas, people spend too much, they drink too much, they they are with family members too much that are stressing them out. And I think we have to pace ourselves and understand what our budget is so that we're not stressed out by a lot of bills later on, and do what you can do and nothing more. And I think lastly, being able to help others. Reaching out and helping others really helps us get away from ourselves and our problems, because when we help others, we realize that although we may have problems, there's someone else that's worse off than you. And so being grateful for what we have, even though it's not perfect, is a really important coping skill. And last but not least, if we feel our depression and anxiety is getting too bad, reaching out for professional help is really important. And a lot of times in our community, we feel like that is something that we shouldn't do, or that it's a stigma that people will think poorly of us if we get mental health help. But in fact, it's a sign of strength, because who can you go to in your life that is not going to tell all your business, who's going to give you an objective point of view? Because sometimes friends and family, they're giving you advice from their perspective, which may or may not be helpful to you. So always remember there's help out there, and seeking professional help can be very helpful. Each one of us goes through ups and downs. We could lose a job or a relationship, and we're temporarily kind of down and depressed. And that's pretty normal. That's a normal reaction to a loss in life. But if you have a family member that, for example, goes past 6 months and being very down and depressed and doesn't want to do anything, and they're isolating themselves, and maybe they had a job and they did something to mess the job up and they're just at home, and you see this going on, then as a family member, you may want to step in. But there's a right way and a wrong way to do that. So I always tell people that you have to lead with empathy. You don't go in and tell somebody what they should do, or just snap out of it. What's wrong with you? Those are all the wrong ways to approach a loved one who's having problems. And sometimes it's a drinking or a drug problem. And we know those approaches don't help. Just stop doing what you're doing. Because if they could stop, they would have stopped. So I think using empathy and trying to find out what's really going on with them and what's really bothering them, because a lot of times people keep things inside. And being a listening ear and being supportive is worth its weight in gold. And really talking to them about, I care about you. I want you to feel better. Tell me how I can help you. And that's really important because you don't want to impose your form of helping on somebody, because sometimes people know how they want to be helped. Now, some of our family members are going to be in denial, and they're like, nothing's wrong with me, leave me alone. But when you can tell something's wrong with them, you want to gently keep pushing. And sometimes the first step can be thinking about somebody that they trust. It could be a pastor or a friend, and having them at least talk to them. Because sometimes going to see a counselor or a therapist is a big step for someone. But if that doesn't work, then it's time to say, look, I know somebody that can help you. And knowing something about therapy yourself so you can explain it. Like, therapy is not some hocus pocus or magic. It's talking out your problems and coming up with solutions that can help your problem, because sometimes we're so inside ourselves that we can't see what the answers to our problems are. And sometimes talking to someone else opens up new doors. Um, so really asking around and trying to find the best person for your loved one, because not all therapists are made alike. And so you want to ask around and make sure you find some good referrals for your loved one. And last but not least, sometimes this is a long process. Change is a long process. And it may take your loved one a long time to really admit that they have a problem and then get help. So be patient and don't give up on them. Just the gentle nudges that you can give are really, really important. And thank you so much. It's been my pleasure.